Welcome back to the show of conversation by OK. I believe you're having a great day wherever you are, any part of the world. I send my love and my hugs to you, my virtual hugs and my love to you. So, you know that all the time we bring special guests. When I mean special guests, they are really in-depth in their field and they have dedicated their time to sit next to me for us to have this conversation. Henceforth, I consider it special because they have sacrificed their time to educate myself and educate you behind the screen for us to be able to understand the conversation that we are about to have. So if you haven't subscribed, please do me that favor. Before you start to watch this, just press the subscribe button, put us on post notification. And if this message you're about to actually hear is going to actually benefit someone, just share it with them. And don't forget to also post your comment and your questions, and we are more than willing to address it. So today, my special guest is a medical doctor. She is a content creator and also a mental health advocate. And over the past years, she has actually been very active in creating content regarding mental health and educating us on it. It's no other person than Dr. Jessica Katanga. How are you doing, doctor?
I'm doing good, thanks. What about you?
Great. Not bad. I can't complain. By God's grace, I'm actually doing well.
Amazing.
But before I actually move on, I have actually got this kind of tradition that I have on this conversation. As a motivational speaker and as a speaker in general, I always believe that people always need words that would encourage them, that would actually motivate them to actually move on to whatever they are doing, because I believe that it has a very much impact on people's mental health. So the quote for today, which I wrote, is, "It is the stumbling blocks we encountered that we use to build the foundation of the bigger platforms we are on now." So if you could resonate, just let me know how this word actually ends up resonating with you. But other than that, go straight into the conversation. So, Dr. Jess, I've seen all the work that you've been doing, and I must actually applaud you for all the massive work that you've been doing in the space of mental health advocacy, because I'm a mental health advocate myself. And looking at your channel and what you stand for, I believe that it started from somewhere. So let's rewind it and take it back a step further back. So when you were entering medical school in 2015 to study medicine, how was the journey like?
Yeah, it seems like such a long time ago now, isn't it?
It is.
Nearly a decade. God. So what was the journey into med school like?
Yes.
So I did my A-levels, I did my AS in maths, chemistry, biology, and English lit, and then my higher A-levels in just a 3 without English lit. And then I applied to medicine, and by God's grace I was able to get in first time. And then med school was a long 6 years.
Wow.
Yeah.
We'll get to that. The way you are listing it, it makes it feel like it was an easy journey. But I know, because listing those subjects, I sitting next to you, I did 3 of those subjects. On top of it, plus physics. So
God.
It was a very, very tough moment. Is there any point in time that you felt like, you know what, is it really worth it with all this stress? Is it really worth me doing all these subjects and going to the med school?
100%. Every chemistry lesson, I was like, is it really that deep?
Yeah.
So yeah, chemistry is something that I really, really struggled with. And then also the interview process at the time for medicine, you had to do it at the same time as exams and stuff. And, you know, we were really young. Like when I look back at how young we were, like we were going through so much stress. So yeah, it was really difficult.
It was really difficult. And entering the medical school, they didn't meet the expectation of what you were expecting, because, you know, before we enter, we go to all these open days. They sell it to us. This university can offer you this. This course is going to offer you this.
Yeah.
Did the university actually offer you this?
Med school or medicine. Yeah, med school is, I think, like no other degree in terms of just the quantity of information that you have to take in. They say it's like drinking from a hose pipe.
Yes.
And in terms of it's like patient contact from day one. So I went to St. George's. From day one we have patient contact and stuff. So it's really, really like unique and special. It was really tough, but yeah, I'm on the other side now.
That's really good. That's really good. And making mention of St. George's University, honestly, I think St. George's University needs to actually be applauded for producing fantastic black female doctors, because in my context, I can actually trace back and I can actually count on top of my fingers, including yourself, about 3 or 4 black female doctors who are doing amazing stuff within the space. So big ups to St. George's University for actually giving us these amazing doctors in our community. So with me, before I actually come to the show, I always tell people to give me their bio, but I prefer to do my research.
Okay.
I prefer to do my research. Reason being is the bio, that's what everybody knows. But the stuff that other people don't know is what I always want to explore from the people, because other people do not understand the journey. They do not actually understand what people actually endure. The only thing they see is this person has produced the content and that's it. I've read this person about this person is receiving this award and that's it. But they don't see the reason behind everything that they do.
Yeah.
So for my research, you did an intercalated degree in psychiatry and neurology, am I right?
So psychology, psychiatry, and neuroscience.
So what informed that decision for you to do that intercalated?
So I went into med school because I was really fascinated about the brain, and I thought that I wanted to be a neurologist. So those are the doctors that specialize like in the brain and nervous system. But then when I started, when I went through medicine, I was seeing that in every specialty, mental health kept on cropping up, and I just felt like a lot of the doctors and surgeons might maybe shy away from that or think that's another person's job, but I just saw that it kept on coming up and I felt like it needed to be addressed, and that was what I was like spending my free time, researching or reading about or watching about is like mental health, and it was just so interesting.
So it's been mental health from day one?
Basically, because I saw that was the basis of everything, and then with the intercalated degree you get to do like a additional degree during a med school. So I picked it in that because it was just what resonated with me the most.
And did you do at St. George's University? Okay, awesome. So would that actually inform your decision of also going into mental health advocacy and content creating on mental health? Because
I was able to go into like the deeper psychology of it. So like with my content with mental health, like I talk a lot about the medical side of things, but also the psychological, like lifestyle, well-being side of stuff as well. And I feel like that's informed by my intercalated degree.
Awesome. And currently you're actually doing your foundation year 2 training in...
So I've finished my foundation year 1 and 2. So now I'm in my 3rd year of being a doctor, and I'm locuming in psychiatry, and I'm currently in learning disabilities.
And how are you finding it?
Really lovely. Working, so like the general patient population, of course, a high percentage of the population have like learning disabilities. So to be able to just focus and learn more about how to cope with like challenging behavior or what their needs are, it's really humbling, and it's been a really great like educational experience.
Awesome. So in terms of your specialty in mental health or psychiatry, which kind of conditions do you come across?
Across all of them. So I guess it depends. So like when I was in F2, I was on the adult female ward. So that would be more like psychosis, major severe depression, bipolar, and personality disorders. And then now when I'm in learning disabilities, I'm more around the so learning disabilities, autism, ADHD, things like that in the adult population. And then my research background is in dementia, so that's in geriatric psychiatry.
Awesome. That looks like a lot, and it comes with a lot of tenacity and a lot of learning, because from one condition, someone will be presented with psychosis, and you have to have the knowledge about psychosis and which medication to manage it. The next moment, you're actually treating someone with bipolar, and it actually comes with its own challenges, I must say, because all the time as a healthcare professional, one of the things that I got taught at uni and I've been applying, they say, don't treat the disease, treat the patient. And there's in the simple much explanation, meaning that yes, the person sitting in front of you might have a bipolar. However, don't focus on the bipolar, focus on the person, because every single person comes with different ways of managing them. Although the bottom line is you might have 3 or 4 patients a day who might have bipolar, but they are not actually the same. 100%. Henceforth, you have to actually end up focusing on the patient and know how you're going to tailor your knowledge, your skills, and how you could actually support them. So that is actually a fantastic job that you're actually doing.
And that's why I like psychiatry, because you get that time with each patient to get to really know the person behind the disease or disorder. Which
is really good. And as an advocate and as a content creator, you are making a lot of impact. And if you're in a society and you're making a lot of impact, it comes with its reward, right? And recently, you were rewarded for all the hard work by Potential Unlocked Awards. Big shout out to Potential Unlocked. Big shout out to David Hall for the amazing event that he held in February at Birmingham. You were in my category. Let's discuss that. You were in my category, and I must be honest, for me to be in that category, and massive shout out to every single person in that category. One of the things I was telling every single person when I saw the nomination was, one, I don't know who nominated me.
Yeah,
I'll be honest with you. I don't know who nominated me. So I will take this platform to actually give a shout out to whoever actually nominated me. I'm still looking for you. So if you are watching this, please reveal yourself. And if you are coming, show me the evidence. Because every single person can crop up and say, I nominated you, but I want to see the evidence of what you wrote about me. But for me to be in that category, I felt that I'm doing something great. The reason why I'm saying that is because all the people within that category have been in that space. All of us have been doing amazing stuff in the space of in the medical field, or in terms of medicine and healthcare. We are doing amazing stuff. So when I found myself and I saw the category, I was like, nah, there's no for me. Not that I'm actually writing myself off. Whoever is watching this, I'm not actually having the imposter syndrome that I cannot do it. But what I'm trying to actually say is that I felt blessed to be among these people who have been nominated, because I only started my advocacy 5 years ago, and I only took it to the social media and took it to the height of creating content in less than 2 years. For these people who have actually been in the category and creating a lot of content and people know them, I felt like, you know what, it means I'm doing something impactful as well. So you winning, I wasn't surprised. Honestly speaking, before our category, I saw Dr. Jess, I say, good luck, whoever wins. And lo and behold, Dr. Jess was the winner of that category, and I was the first runner-up, let me put it that way. So it showed how much you are being appreciated within the community and everything. How did you feel like when your name was mentioned, that you're the winner?
Yeah, I was truly humbled, because as you say, like everybody that was in the nominations are doing amazing things. And then the night of the awards show was amazing, just to be around, like beautiful, successful Black people just trying to make a change in their own niches. Like it was so inspiring. So to be a winner, I felt really humbled and grateful.
Awesome. So was that your first time being recognized, or you've been winning other awards in terms of recognition?
I've won awards like distinctions and merits, like during med school and things like that. But in terms of for my content, that's the first.
That's
award.
The first one. Yeah. Fantastic. So it means there are more to come. Honestly speaking, because all the time, what I tell people ask me that, what do you do with these awards? Because regardless, people are actually seeing the work that you're doing. But what I always tell them is that these awards ends up putting me on the next challenge. Because I don't want to take an award and stay the same. I don't want to get an award and actually stay within the same within that same box. I want to step out and actually make impact. So to me, it's more of making the impact that actually really motivates me. Whether win or no win, it's all about the challenge that I want to step up. And it's been working, because that's how I've seen awards, and it's been working. So fantastic, and there are more to come. Awesome. So we are moving on to the consultation session of this conversation. So if you're watching this and you haven't subscribed, or if you're new to this channel, this is the self-conversation by OOK. So please do well to stay glued to the conversation and the consultation that we are actually about to have. So Dr. Jess, you actually shared that some of the conditions that you come across are psychosis, schizophrenia, and bipolar. So today in the consultation session, we're going to actually discuss bipolar.
Okay.
The reason why I chose this topic is because in terms of the community that you and I come from, when it comes to mental health education, we are really limited when it comes to the disorders and the challenges. And even we being in the healthcare profession, sometimes it takes some time for us to be able to decipher between one mental health condition and the other, because the traits and the symptoms are kind of similar. And from my research, one of the things that I found out was that the bottom line of most of these mental health conditions comes with depression, which bipolar is one of these kind of mental health challenges and disorders. So for my viewers, just the definition of bipolar before we actually step in. It is a mental health condition that affects one's mood, and it can swing from one extreme to the other. And it has got two phases. We've got the manic phase, and we've got the depressive phase, which Dr. Jess is going to actually talk us through about what does it mean by manic and what does it mean by depressive. So Dr. Jess, the floor is yours.
So as you said, bipolar is that swinging of mood between the two extremes. So depressive episodes, I'm sure we can probably the viewers know that one I'm sure the viewers are more aware of what depression is. So that depressive disorder is defined as minimum 2 weeks, but it's usually lasting for months, of low mood, low energy, and hopelessness, and other physical symptoms that you can get during depression. So that could be disturbed sleep, disturbed appetite, disturbed libido, disturbed concentration, a lot of different things. So that's the low mood. And then the mania, which is, I guess, is less talked about,
it's
just
less
in
talked
general,
about,
and especially I think in our communities.
Yes.
So the mania is basically like feeling very, very high, having a lot of energy to the point that you're not sleeping for days. You're talking really fast. You have a flight of ideas, just ideas running through your head, and you're talking really fast, and you feel really grandiose. So it's like you feel on top of the world, like, you're the best thing since sliced bread. You might be irritable at this time, and the thing that is risky about it is that you might engage in riskier behaviors than you usually would. So things like taking certain sexual risks or taking certain money risks. Buying things or gambling it away, stuff like that. Or put yourself in dangerous situations because you have that grandiose sense of self-worth at that time. With bipolar, we can have the mania or hypomania, and that's what differentiates between bipolar 1 and bipolar 2. So hypomania is like just a little bit less than the full manic episodes, and that's why it can actually go for so long being undiagnosed, because sometimes our society actually rewards kind of like being really dedicated to something, not sleeping type thing like that. So it can go unrecognized.
Wow. Like this actually, I wanted to be in depth, but I never actually expected to be in that depth by Dr. Jess actually explaining bipolar 1 and bipolar 2. So in terms of bipolar 1 and bipolar 2, you said the difference is to do with the mania, right?
Yeah.
So how would you be able to differentiate between that, or is it the responsibility of the psychiatrist to be able to differentiate? And does that actually make a difference in terms of treatment?
Yeah. So yes, up to the psychiatrist to be able to will take a full history from you, and then also takes a mental state examination, which is basically like kind of a snapshot of what you're presenting like at that time, to make a diagnosis.
Oh, okay. Awesome. And you were making mention of some of the symptoms that the patient actually experienced. Is hallucination one of the symptoms?
So no, you don't get hallucinations in bipolar. Hallucinations would now be more psychosis. So this one would be, no, there's no hallucinations.
There's no hallucination. Awesome. Thank you very much. In terms of, you've made mention of the symptoms that the patient might actually end up experiencing or actually presenting. What are some of the possible causes that may make someone develop bipolar?
So the exact cause is unknown, but we know that there are some certain things that can trigger it. So it can be, it's definitely got a genetic factor. So if somebody in your family has it, then you're more likely to have it. And then also stressful events, like a lot of the mental health issues, it can be brought on when your stress is just over capacity.
Awesome. So it actually goes to say that in terms of bipolar, as the cause is actually unknown, and you made mention of stress, it's really important that people need to end up taking their mental health very serious, because something as little as stress could actually escalate to actually leading into that over a period of time. So it's really important that we take good care of our mental health, because you could actually accumulate stress. Once you're feeling that stress, it's important that you find someone to actually speak to get a load off your shoulders, because most of the time from the community that we come from, as you made mention, hard work is rewarded. Henceforth, a lot of people can go to the extreme to the point of actually risking their own health to actually end up getting that reward. So please, it's really important that we prioritize on our mental health, as Dr. Jess actually shared that it could actually also possibly lead to bipolar. And I was actually doing the research, and in terms of demographics, I was really shocked. This one of the statistics that I actually ended up finding was that it often develops between the ages of 15 to 19 years old. And when I checked that, and I was like, 15 to 19, what exactly could a 15 or 19-year-old be going through that could actually end up possibly leading to that condition?
So again, if you think about stress, and that's interesting because it's like sometimes we kind of just maybe look at children and think, oh, what are they going through? But you know that it is a lot of changes, especially in that late teens. And I think one major thing that is not really appreciated in terms of mental health is uni. Uni is a really high stress environment where somebody's away from their family, first time that they're in charge of like their studies and money and friendship dynamics and different things. So I think uni is probably a really big factor in that.
Awesome. And in terms of another statistics that I actually found, it hasn't actually got any form of gender bias, race bias. It can affect anyone.
Can affect anyone.
Be it male, be it female. It can actually really affect any single person. And it comes to actually end up to say that in terms of the symptoms, would how a man would express symptoms of bipolar, would it be the same? Because statistics always actually end up, or research have actually shown that men are less likely to show their emotions. So how would we be able to end up find out if this particular man is going through this and they need to actually be referred?
Yeah, that's a good question. It's definitely the way that men present or don't present with mental health issues is going to be different to women. You know, again, as I said, how like hard work is rewarded in our community, and especially for black men, it's just like, well, that's your primary focus is to provide and to put other people's needs before your own.
Exactly.
So maybe even if you're not sleeping for ages, or if you're really focused on one project, then maybe the people around you might congratulate you rather than seeing that, okay, this is actually an issue. So it might mean that somebody presents too late. Men usually present later on. And then also with the depression side, you know, I guess amongst you and your friend, I guess because you're the man, so you might be able to know better, but I feel like emotions, like amongst the mandem and stuff, I think maybe it's just something that is brushed aside, or you kind of just firm it, move on.
It is.
Or something that you deal with by yourself.
Yes.
Compared to, I think women, we always talk out even the littlest things to the biggest things.
Exactly.
But I've found, just from what I've seen with black men, that they would rather deal with things on their own.
Self-medicate even.
And self-medicate sometimes, yeah, exactly. Alcohol, weed. So it's like I'll deal with things myself, and then when I'm good, I'll then present myself back to my friends. But I think that true friendship is when you can go through the good and the bad with each other. Exactly.
True friendship is when you can go through the good and the bad with each other. So demand them out there, please. let's check up on our fellow men, honestly speaking, because as I just actually made mention, some people decide to draw themselves out, get themselves better before they actually end up getting back on the marathon. But I believe that if one member of the team is actually experiencing that, we have to actually end up stepping back, get him better, then we can actually go on the marathon, because we cannot decide that, you know what, let's leave him behind, let's win the marathon, we come for him. Maybe by the time you come back and look at him, it might be too late. So it's really important that we end up prioritizing on each other's mental health, at the same time prioritizing on your own mental health as well. And talking of females, I was doing my reading, and one of the things that it actually ended up popping up is bipolar in pregnancy.
Okay.
Because if someone is actually being diagnosed at that particular point in time with, if the person is pregnant and got bipolar, one of the things I was just thinking about, because one of the medications that we use for mood stabilization is sodium valproate. And sodium valproate is actually not to be used in women of childbearing age. So if a woman is pregnant, or if there's a woman behind and is actually in the process of pregnancy, or there's any male behind, or there's any family who is actually watching this and they've got someone who is pregnant and is actually experiencing symptoms of bipolar, how should they go about it?
So of course you can't give personalized medical advice when I don't know their file or what the medications they're on.
Exactly.
But so definitely, if somebody has bipolar and is wanting to get pregnant, then we would class bipolar as a serious mental illness. So you can go to your doctor and you can say, oh, we're thinking of starting to conceive, so that you can have a consultation with your doctor, with your psychiatrist, with your obstetrician if needs be as well, so that you can come up with a plan. Yes. Because if we know well in advance, then we can make a plan and it should go swimmingly. So sodium valproate is one of the mood stabilizers, but like we can use other things like lithium, and I believe that lithium is safe in pregnancy. And if somebody's been stable on meds for a long time, then they should be able to continue on in pregnancy. But that's just a discussion to have with the doctor. There's definitely options, because keeping someone's mental health in tip-top shape during and just that bit after giving birth is really important.
Yeah, thank you very much. So as Dr. Jess has already shared, it's really important that if it comes to that particular point, you have to include your healthcare team in the conversation. Let them be aware that this is the decision that you would like to make, and they are more than willing to, because most often people are actually afraid to actually get them involved, because they feel like, especially from the community that we are coming from, they feel like if they go, their life will be restricted. Oh, they'll tell them that you can't get married, you can't settle down, you can't do this and that. However, if you actually get them involved, they are the best to actually end up giving you the best advice, because you don't want to put the baby at risk, because some of these medications are not supposed to be taken whilst you are conceiving. Henceforth, if you make that particular decision and they're able to know in time, they will know how to actually go about your medication and how to support you in order to be able to have a successful pregnancy and a successful childbirth as well.
And that's good that you said the conceiving part, because it's both men and women. If they're wanting to conceive, they should, the man can also go to the GP and say, we're wanting to have a baby.
Awesome. Because to actually even come to that point, sodium valproate right now has put men also as part of the monitoring, whereby at first used to be only women, but men on sodium valproate also have to actually be monitored. So anyone watching this is actually a piece of knowledge that I actually gained whilst I was actually working at the hospital, and I came across the new sodium valproate patient information leaflet. So let's take note of that as healthcare professionals, and also anyone who is actually taking that as well. So every condition, one way or another, will come with a treatment, right? Because our whole aim is to be able to manage the condition, because the medication that you're taking will not prevent it. However, one way or another, you'll be able to manage the condition to be able to help the person to have an effective regular lifestyle whereby it doesn't restrict them. So in terms of bipolar, what are some of the non-pharmacological approaches that we can actually use before even the person could actually end up taking medicine? Because people end up thinking that, yes, if I'm going to take medicine, it's for life. But is there anything I can do to get better before we can actually take medications?
Interesting. I would think that for bipolar, I think it's the one where the non-pharmacological would go alongside the pharmacological. So definitely therapy to work through the the low feelings during that depressive stage and whatever triggered it, whatever stress, and then also the manic episode after you then become well again. The things that you might have done during that manic episode, or the way that it's impacted the people that were around you, probably will cause you stress as well. So it's really helpful to be able to talk through those things with a trusted professional.
Awesome. So CBT, one of them.
Yeah.
Then we talked about therapy, which is another one of them. And you talk about lifestyle changes, advices such as diet, exercise, and anything that could actually end up. Because one of the things that people do not actually end up always get it misconstrued is they end up thinking that the medication is going to bring everything back. Like once you take it, it will just kick in. But one thing that people need to actually understand is that some of these medications, it takes weeks to actually work. So you might take it now, you might not see the effect the following day. No. Every medication has got its own way of actually working and how long it will last within your body. So if you're taking the medication, or you have actually been newly diagnosed and you're taking the medication and you feel like it's not working, just give it a bit of time. It's going to actually work. Your doctor might have actually ended up giving you all these kind of information to actually understand how it works and how long it's going to take. Henceforth, taking it regularly as is being prescribed by your doctor is really important to actually follow that. So that's actually a piece of advice. So don't lose hope. Just continue actually taking it and include, as Dr. Jess actually shared, it goes along with the pharmacological approaches such as exercise, such as the food we eat. People don't actually get how much impact the food we eat have on us. So it's really important that you actually touched on that. So just to actually wrap it up, there's these studies that I found and I was quite triggered with these studies, I'll be honest with you. Because I know that we actually end up discussing a lot of racial disparities when it comes to healthcare. But when I actually found this studies, by the way, was actually done in America in September 2018. And the title of it is Racial Disparities in Bipolar Treatment and Research Studies. And just a little bit about the abstract. So the sample size was taken from patients of African and European heritage. And they actually ended up finding out that they were racial biases. And the racial biases that was actually found from the studies was one to do with misdiagnosis, whereby people who have got bipolar from the African community were rather being diagnosed as schizophrenia, which is something that we made mention about, that some of these symptoms are actually similar. And secondly, in terms of the sample size, there were not much from the African community that were actually selected to actually represent. So the number that was actually taken is what was actually presented. And also the other one that I found that was actually one of the reasons why this was actually found was in terms of disease classification, which is ICD International Disease Classification, International Classification of Diseases, and also the other forms of classification of diseases were some of the reasons why this happened. Is this something that it actually normally happens, or this is just one off?
So yes, in terms of bipolar or black people being over-diagnosed with schizophrenia or wrongly diagnosed with schizophrenia or psychosis, that is very common. And we see that so schizophrenia is very much like a racialized or stereotyped disease, where before, and there's this book called Processed Psychosis by Dr. Joseph Metzel, if you want to read that, and it's about how during the civil rights movement, how schizophrenia moved from being a disease that was usually, the misunderstood white man or the like nervous white housewife to one of being the angry black man or angry black woman. So I'm not surprised at the fact that, because again, with mania and psychosis or schizophrenia, in both you're acting erratically, but there are, subtle differences. So definitely stereotyping and racial bias does come into play. And it's really important that we, racial bias kills, and it's really important that we diagnose accurately. And that's why I'm so passionate about getting more black doctors on board, because we have to reflect the community that we're serving. Because there's some certain nuances that can easily be mistaken as pathological, when no, it's not. That's just part of the culture type thing. So it's really important that we diagnose correctly so that people get the correct treatment, because because so that people can get better. Because like, so for example, if you don't take a full history and you only think somebody's depressed, but you don't ask for whether they've had any manic episodes in the past, or you don't screen for that, you might give them SSRIs, and SSRIs are actually avoided in bipolar. So, some things are avoided in some of the things, so that's why diagnosis is important.
So for those who actually didn't understand what SSRI means, it's actually used for treating depression, and it stands for Selective Serotonin Receptor Inhibitor. Am I right?
Selective serotonin reuptake inhibitors.
Reuptake as a receptor. Reuptake inhibitor. Thank you very much. I've got the expert over here to correct me. That's why she's here. Expert. Thank you very much. And as you made mention of it, that you are not actually surprised that racial disparities or racial bias actually ends up eating into some of these diagnoses that are actually made. What steps, or if there's been any steps being put in place, what steps have been put in place to actually end up minimizing or killing that kind of culture?
I mean, so they're trying to talk about cultural bias and unconscious bias in healthcare programs. So, I mean, they're trying to do that. In terms of the efficacy of it, I'm not sure, because, black people are still dying at rates that are unacceptable. We all know the statistic of, black women being 5 times more likely to die during childbirth. That is just due to, unconscious bias and things. So, and we all know when, our own family members and friends go to hospital and they're still, disregarded. So things are getting better. Whether we have the quantifier of that yet, no. But But yeah, that's just what I'm passionate about. I want us to, because yeah, that mistrust that is in our community, or that disengagement with healthcare, is very much founded on the fact that we've been continuously let down by a certain establishment. So it's no surprise. Yeah, and then now when we want our community to be able to go to these hospitals, but then when they go to the hospitals, sometimes they're met with resistance or with discrimination, and nobody wants to go through that, especially when they're feeling unwell already. So yeah, we just have to continue that work.
It's true. And as you made mention of it, that there's been much done, but still it's actually going on. Because this week I actually read about how a black woman in Liverpool, a pregnant woman to be specific, was actually neglected and she passed on. Whenever I hear news like these, it's very sad, because it's not like nothing is being done within the black community itself. A lot of stuff being done, and one of the ladies that I follow her work, Agnes Japan, who is actually trying to end up fighting to help and join forces with a lot of organizations in the NHS to be able to minimize the mortality rate of black women mortality in terms of childbirth. She's actually fighting so hard. So when I actually hear these kind of news, it makes me actually, sometimes as a healthcare professional, it actually breaks my heart.
Yeah.
Because I end up saying, at what point was something not seen? At what point was something overlooked? Because as you made mention, that it's really important that we have representation within the healthcare field. It's really important because there are certain things that our culture, how a black woman will express herself during pregnancy, will be totally different from a different race, right? So if you don't have someone within the midwife who is well versed, who understands how or what the body or the physiology or even how the hormones react on the black women, they might not receive the same care. Because one of the things I've actually realized is that, like, looking at my mom as example, when she's pregnant, her temper actually flies up.
Okay.
Henceforth, she will act in a certain way.
Okay.
So imagine that she does that in a hospital and there's someone over there who is not from our community, who doesn't understand her. They will ignore her. Yeah. But that might be how she's expressing her pain. Yeah. And that particular point in time is critical. Yeah. And if it's not responded, it could be fatal. Yeah. So it's really important of the work that we are doing and the space that we are actually in to ensure that the good works are actually carried on, and stuff like these about racial disparities are well addressed and not something that we keep our mouth shut. Because today we may start this conversation, we might not know that tomorrow someone else from closer to us is going to have the positive impact as well. And to sum it up, oh, sorry, did you have something to say?
Yeah. In terms of that example, thank you for sharing that. It's true. Again, with like depressive states, black women sometimes can show irritability as a symptom, and a lot of people might just think, that black woman just has attitude, but that can actually be a way that somebody's depression shows up.
Yeah. It's really important. It's really, really important because representation really matters, as is something that the NHS has been championing. That representation actually really matters, and it's down to us in our community to spread the word, to be able to get more people on board, because there's power in numbers. Yeah. When we say more people on board, we mean that there's more people within, let's say, the space of mental health space, to the point that every hospital or every team that you meet, you will find someone from the community who really understands, who really championing it. Therefore, anyone within that community from the African background or from the African heritage or the Caribbean heritage will be able to actually receive that kind of treatment without being overlooked, by taking into account their culture, by taking into account how the person feels, without actually basing on the assumption on how the healthcare professional actually feels. And in terms of the field of research, one of the things I found from the studies was that there was underrepresentation of the people from the African heritage within that research that they did in 2018.
Sorry, what was the question?
The question was, in our community, the paper that I actually read, that there was underrepresentation of people from African heritage in the studies. There was less inclusiveness. Henceforth, there were gaps within that particular kind of studies, and it might not be representative of the Black community. Do you think the community that we come from, we have got enough knowledge about the effect of representation in studies like this, like showing up to this kind of research?
Yeah, there's less representation of Black people in a lot of research studies, which is a shame, because yes, research is important, because that literally guides clinical guidelines and medicines and laws and stuff. So we definitely should be involved in research. I think that, again, it's just about the mistrust that we have. If, when we need to go to hospital, we don't get treated that greatly, why would we then now voluntarily go for just, but yes, research is important. And if you can join, maybe sometimes, a lot of the times, people from our community are busy and things.
So many factors.
Yeah, a lot of factors that come into play. So, but research is really important, and I would love to see more Black people getting involved in clinical trials.
Fantastic. And on the flip side of stuff, do you think we've got enough Black researchers who would take these kind of actions in including loss of Black people? And the second part of the question is there enough funding available for Black researchers to be able to actually at least end up conducting this research that will be more representative and it will be more accessible to as healthcare professionals?
So yeah, the Black people are underrepresented in academia. I think in terms of how many Black professors there are in the UK, I want to say it's definitely no more than 20. I think it's only like 8 or something like that.
I've met one, actually. I've taken a picture with one. He is actually a professor in sports. When I was the ACS president, he came. Amazing. I had the privilege of actually meeting him through one of the great gentlemen that actually helped me to actually meet him. So I had that I've had that privilege of actually meeting one. Yeah.
So yeah, we need more Black researchers. That's why I really enjoy research, and I try to encourage other Black medical students to go into research as well.
Yes.
But yeah, academia is less money, and again, there's just lots of factors that go into it. But yeah, I would definitely say that we need more Black people in academia as well.
Awesome. So thank you very much if you've been watching this consultation. I believe that you've actually learned a lot from Dr. Jessica Katanga. She came fully armored with all the answers to all the questions, which is what this consultation or the conversation is all about, to be able to educate our community and empower our community as well, because there is a lot that we can do as a community, and there's a lot that can be achieved when we come together, and there's a lot of representation. There's difference between being offered a space and there's difference between we creating the space. I believe that we have to end up, as much as we are actually seeking for a space around the table, we need to continue to create more of our own spaces, which is where this actually space is actually being reserved or being put up, to ensure that we be able to educate certain things, to be able to make it more informal, because most of the time accessibility to information is also key as well. A lot of people have got a lot of questions on their chest and they would like to ask, and they don't know who to ask, and they don't even think like they're gonna get that kind of reception that they would end up actually getting. So if we get special guests like Dr. Jessica Katanga sitting right over here, being able to give us all these advice, I believe that it's actually a privilege for myself and for anyone who is actually watching to be able to enjoy this conversation and learn a lot. So up until then, I would say thank you very much for actually watching this content, and I can't wait for the next episode. Have a great day.
Thank you. Bye.
Woo,
that's my thingy?
Oh, my bad. Rewind. Because Dr. Jessica is on this platform, and for the new viewers, or for my new viewers who are going to see this for the first time, who would like to follow her projects as well, please, Dr. Jessica, give us where we can actually find you.
So you can find me on Instagram, TikTok, and YouTube at Dr. Jessica Katanga. That's DrJessicakatanga. See you there.
Awesome. And also, I'm gonna put the link in the bio as well, so that you can actually follow and support the work. Support is really important, because it's the support that helps us to actually know how much engagement that we are actually getting. So please support and share it for us to actually get the word out there and reach as far as it can actually reach. Because I know someone within your friendship group, someone within your family, someone within your work area, someone within the religious community is going to actually benefit from this content as well. So up until then, see you at the next episode. Have a great day.